Hello, I'm Dr. Smitha Prabhu. I'm a consultant in KLE's Hospital and I'm also professor in medical college. I run the pediatric ophthalmology department in KLE's hospital. And today I would like to give a few insights into the epidemic keratoconjunctivitis, which is rampant nowadays. What is it? It is the common pink eye or red eye which is spreading so fast amongst us today. So let's know what it is. This conjunctivitis means there is a thin layer in front of our eyes, that is the conjunctiva. So it is very superficial or the front part. So it is getting infected either by bacteria or virus. So when you have this infection, this spreads because these are bacteria and virus. They have a tendency to grow outside our eyes and they just thrive on one eye to other. So like we saw in the COVID pandemic, this is a simple variety of that. It can be, as I told you, because of the virus, when it is called epidemic keratoconjunctivitis, where there could be also some bacterial infection in this. So that is pink eye or red eye. So what are the symptoms? What happens when this occurs? What we see is the patient slightly starts with itching or irritation in the eye, heaviness, watering, and then gradually the redness comes. And then you also have that yellowish discharge sometimes, or whitish or mucoid dirty discharge which comes out of the eyes. And when you get up in the morning, you will have sticky eyelashes and all irritation in the morning. So it can also be accompanied by some blurring of the vision. So one more thing is, when you see this, when the blurring happens or the stickiness happens, we tend to rub our eyes, or for the itching. We tend to rub it, and once we rub it, we touch everything surrounding us. We touch our mobiles, we touch our pens or whatever surfaces, and we leave it there. That is how, when the next person comes, they come in contact with that, and that is how it spreads. That is why it is very rampantly spreading nowadays. So what is the difference between this bacterial conjunctivitis or this viral conjunctivitis? As these are the main two varieties which are spreading nowadays. Usually the virus, like the COVID, spreads very fast. That is why we are having it, seeing it spread in all schools or in public places, even in hospitals. When you visit for some other reason, when you come back, you might be having conjunctivitis because some patient would have already visited there and touched the surfaces. So in these days it is spreading because of these contact surfaces. Virus is, you will have redness and watery discharge mainly and itching. But in bacteria you have that stickiness and yellowish discharge. So these are the two main things which differentiate from each other. But for a lay person, you don't have to worry which type. You, irrespective of whatever, if you have a little bit of redness or any irritation, watering, immediately you should consult a ophthalmologist, that is an eye specialist for you, and not a pharmacist or a drugstore or a quack, please. Because what happens when you visit a pharmacy, what they give is over the counter drug, OTC. What they give is, most of them give you a antibiotic steroid combination or some whitish drops which are available as small droplets to be instilled in the eyes. So these are the worst things that you can do for your eyes, because that steroid used indiscriminately can damage the cornea or the central part of your eyes, that is the black part of your eyes, which is the very clear part which needs to be very clear for your vision. If you use these steroids indiscriminately without consulting a doctor, what happens is they will get destroyed and your vision will get down, and it is very difficult even for us to treat it. So don't go to these people, and please visit an eye doctor at the earliest. And how it spreads is, as I already told, with the contact method. Now this prevalent EKC or epidemic keratoconjunctivitis, what we call, it is spreading even as a fomite, that is not only just touching the eyes, it is by in the air also it is spreading. So it is so strong. So just be careful, wear your protective goggles if you are having conjunctivitis, and please be isolated. Don't move around, don't touch surfaces, don't finger your eyes and then touch anything. Just when you put your drops, just wash your hands and keep everything separate, like towels, handkerchiefs, or your pens, or any of your items. And even in your homes, you can stay away from others for some time. And please, children don't go to school for minimum 3 days, okay, so that you can prevent spreading it to others. And parents also should not force the children to go to school in these days, because first of all, they will be spreading it to others, and second, they will be straining their eyes too while for studying and other things. So please stay back, take care of your eyes, and that would help a lot. And what preventive measures you can take, I would like to tell that don't touch anything, any of these surfaces, and keep washing your eyes. You can also use some lubricating drops so that all dirt and these things or fomites are washed off. And basically maintain your eye hygiene. Don't rub your eyes when there is itching or something. Just avoid just wash your eyes and don't rub it. And when you go to the doctor, they will give you few medications. One more thing is they will give you antibiotics. So virus will not get affected by antibiotics, but viral infections can also get bacterial second infection. So to prevent that and to make you comfortable, we give antibiotics. So please use them. And when you have very severe symptoms, even the doctors can give you some steroids, but they will decide it. So those drugs you can use for 5 to 7 days, maximum 15 days, and your symptoms will come down. And there is another prevalent kind in the schools, that is pharyngitis, that is throat infection also. Not just eye disease, they may also start with throat fever, throat congestion, coughing, and that is something little bit more serious than this. But not to worry, it is short lived, 3 to 5 days it will come down, but again you have to visit your pediatrician or eye doctor. They'll take care of you. Parents also, it can easily spread in the household to your other children or yourself, and so you too need to take care. And regarding some myths I would like to bust here are these putting what mother's milk or some over the counter drugs. These things will definitely immediately clean your eyes. Okay, please don't do all these things. Please go to a doctor and it will go off by itself. Yes, I do agree, it will go off by itself in 5 to 7 days if you don't treat, but some strains of virus are so strong that they will damage your cornea, I told the clear part of the eye, if you don't take treatment. So you need to go to a doctor instead of just leaving it aside like that these things are very much important. So I would like to tell you that please take care of your hand hygiene. Keep washing your eyes like you used to do in COVID era. Please wash your hands properly and don't touch your surfaces. Avoid going to hospitals for simple reasons. If it is serious, you need to go, but reduce your hospital stay. Don't touch any of the surfaces anywhere, and even in schools, and avoid going to swimming pools. Avoid wearing contact lenses, and you can just use some lubricating drops in case of any issues. So that would be a simple message for me and from our hospital to all of you polites and your parents. Thank you so much.